In the afternoon, from 1 to 5 p.m., there will be a conclave session arranged at Chiang San, Kasarong, Chiang Rung 1, 2, and 3 room, respectively. You can see each topic from your document, or you may look at the schedule from the information brought in front of the conference room. In this morning, there are 2 panelist sessions and 2 topics to be given. The first one is keynote speaker from 9:30 to 10:20, and then we will have a coffee break.
Good afternoon. My name is Christine Smith, and I'm here today to present some findings from the research I conducted for my Masters of Health Professional Education, titled Rediscovering Nursing, a study of overseas nurses working in Western Australia. This is a topic that I'm very passionate about because I'm myself from overseas, and I felt that it was an area that needed to be explored and discussed. As I'm sure you're all aware, there is a shortage of nurses in the world, to a point of global crisis, as stated by the International Nursing Council. This phenomenon does not only affect developing countries, but also industrialized countries, including Australia, where this research took place, and more precisely in the states of Western Australia. As a result of a shortage of nurses, we have seen in Western Australia an increasing and ongoing migration of overseas qualified nurses. However, in order for overseas qualified nurses to be eligible to work in Australia, regulation regarding migration and nursing registration are in place so they can fulfill the Australian professional nursing requirements. This research was looking at how 13 overseas qualified nurses from a non-English speaking background who have been successful in gaining their registration and also in gaining employment experience nursing in Western Australia, Perth. Individual interviews were conducted and transcendental phenomenology using Mustaka's framework was applied to analyze the data. The participants came from 9 different countries: China, South Africa, Japan, Taiwan, Zimbabwe, Hong Kong, the Philippines, Sweden, South Africa, and Nepal. They lived in Australia between 4 months and 20 years, and their age ranged between 25 to 55 years. And they were working either in a private or public hospital, a total of 6 hospitals. Oops. In this research, 4 major themes were identified, highlighting the professional journey the participants went through. They were the initial feelings of professional loss, feeling of otherness, rediscovering nursing, and it all works out in the end. However, for the purpose of this presentation, the third theme, rediscovering nursing, which encompasses 4 sub-themes, namely preparedness to work, working with patients, working with doctors, and let's talk about professionalism will be discussed. In relation to their preparedness to work in the WA hospital setting, the participants were able to find similarities in the practice of nursing. It is the same. At the end of the day, all we do is we look after sick people. That's the purpose, and the goal is the same. However, they also found differences. The work is not much the nursing skills here. The emphasis is on communication skills, and we have to do everything. They realized that they had broader clinical skills than their WA colleagues. However, the holistic approach to patient care and the high level of communication skills left them overwhelmed. Furthermore, they were not all familiar with the other health services. Our society doesn't have the resources to help people, so it's not part of the care. You don't pay attention to patients' psychosocial issues. Here, in Western Australia, it's a large part of our duty. The limited and often unfamiliarity with the extended and specialized highlight health services available to patients left many participants confused. With working with patients, the participants felt that the nurses' approach to patient care and the patients themselves were different to what they were used to. The patient-centered approach surprised and pleased them. I only look after 4 patients instead of 40. I love it at the first